Hi, Madam Norita. We are Group 3, and our members are Ling Jing Yao, Lutfia, Fatima, Harini, and Adam Shalfi. So, our topic of the assignment is about deep brain stimulator, exploring the innovation and impact of deep brain stimulation in neurological treatment. To kickstart, let's have a brief introduction. A deep brain stimulator, or DBS, is a medical technology that helps individuals with various neurological disorders. By delivering controlled electrical impulse directly to targeted brain region, DBS can modify abnormal brain circuit and improve symptoms of diseases such as Parkinson's and essential tremor. Over the years, significant progress has been made in understanding how DBS works, refining the technology and expanding its application. However, there remain important unanswered questions about its precise mechanism and long-term effects. Our paper aims to explore the latest innovation in DBS devices, impact of this development on neurological treatments, and current limitation of DBS as well as the proposed enhancement of DBS.
Deep brain stimulation, or DBS, is a neurosurgical procedure that uses high-frequency electrical stimulation to modulate deep brain structures. A DBS system comprises of three components: a thin insulated electrode implanted in the brain, an extension wire, and a pulse generator that is placed under the skin in the chest area. The pulse generator delivers controlled electrical signals to the electrode, targeting specific brain regions to restore normal neural activity. The process begins with pre-surgical counseling and patient selection, ensuring suitability based on disease severity. During surgery, a stereotactic frame and MRI imaging precisely locate the targeted brain region, with accuracy down to 1 mm. Electrodes are inserted through small burr holes in the skull and connected to the pulse generator. Neurologists then program the device to adjust the amplitude, frequency, and pulse width, customizing the therapy for each patient. DBS is most commonly used to treat Parkinson's disease, where it alleviates symptoms like tremors, rigidity, and bradykinesia by targeting overactive regions like the subthalamic nucleus and globus pallidus. By restoring the balance of motor signals, DBS helps patients regain control of their movement. It is also effective in psychiatric disorders like obsessive-compulsive disorder, or OCD. For example, in OCD, hyperactivity in the cortico-basal ganglia thalamocortical loop leads to intrusive thoughts and compulsive behaviors. DBS modulates these circuits, rebalancing neural activity and increasing serotonin release, which helps to reduce anxiety and obsessive symptoms.
So, continuing on, a Spanish neurologist from back in the 20th century once said that the brain is a role consisting of a number of unexplored continents and great stretches of unknown territory, but traditional medicine still haven't really touched some of these territories yet. So I'm going to address those limitations of traditional medicines and how deep brain stimulation redefines them and touches those territories instead. So first up, surgeries like palaeotomy and thalamotomy, they sound fancy, but they're basically about permanently damaging parts of your brain to stop symptoms. Like, sure, they might help for a bit, but the catch is that you can't undo the damages. Patients can end up with permanent issues like speech problems or cognitive impairments. So yeah, not that great. But now, deep brain stimulation, or DBS, comes in as a total game changer because unlike those surgeries, DBS doesn't destroy anything. Instead, they implant electrodes in your brain that send little electrical pulses to specific areas. It doesn't cause any permanent changes to your brain, which means that even if something goes wrong, they can easily just tweak it or remove it entirely. Plus, it's super flexible. Doctors can adjust the settings in real time depending on what the patient needs and how much they need the stimulation exactly. So it basically just evolves as the patient's condition changes. And that's something traditional treatments just can't really do. And another thing, that DBS has way less side effects compared to meds or surgeries. So, with having no permanent damage, fewer risks, and a better quality of life for patients, basically DBS offers hope and redefines where other treatments are lackluster or fall short.
DBS is a revolutionized neurological and psychiatric disease treatment enhancing quality of life for Parkinson's, dystonia, and essential tremor patients. However, it is still presented with some limitations. DBS controls symptoms but does not treat the neurological disorders such as Parkinson's disease. It reduces motor symptoms but does not stop the disease's development. Different patients respond differently, with some seeing partial improvement. Targeting and programming are crucial as these are depend on electrode placement and stimulation parameters. DBS system also faces limitations in technology. Battery life is a major issue, requiring regular surgical replacement, increasing risk and discomfort. Hardware-related issues like lead migration, breakage, or infection can also occur. Emerging technologies like wireless system and rechargeable batteries aim to address these issues. DBS eligibility is influenced by factors like age, comorbidities, and mental stability. Access may be restricted due to financial, geographical location, or healthcare inequities, and in limited resources due to high costs and long-term follow-up care requirements. DBS raises ethical concerns, particularly when used for treating mental illness like depression or obsessive-compulsive disorder. It alters brain circuits linked to behavior and emotions, potentially impacting an individual's sense of self. The psychological toll of brain surgery and implanted devices can cause anxiety and irrational expectations among patients, further complicating the treatment process. DBS could be enhanced through several creative improvements. Targeting neuronal circuits accurately is crucial in DBS, but current methods often rely heavily on intraoperative electropsychological data and preoperative imaging. Enhancements including high-resolution imaging techniques and closed-loop robotic assistance, which can improve neural network mapping and reduce human error. Adaptive stimulation systems such as neural feedback integration and machine learning algorithms can address these issues by modifying stimulation parameters and optimizing patterns over time using predictive algorithms. Current electrode designs face limitations due to biocompatibility and scar tissue formation. Improvements include miniaturized flexible electrodes for tissue injury prevention and conductive polymer and coating for longer-lasting, reliable devices, reducing immunological reaction and improving signal transmission. The integration of DBS with brain-computer interfaces (BCI) can enable highly adaptive and customized treatments, providing precise stimulation patterns and improved patient monitoring, allowing patients to have more control over their treatment and receive real-time feedback.
In conclusion, deep brain stimulation represents a significant advancement over traditional treatments like pallidotomy and telemotomy. Unlike those irreversible procedures, DBS offers a non-destructive approach, allowing for adjustable, real-time treatment that can evolve with the patient's needs. With fewer risks and side effects, DBS holds the potential to improve patients' quality of life while avoiding the permanent damage associated with other treatments. As we continue to refine and enhance this technology, it promises to redefine the future of neurological care, offering new hope where conventional methods have limitations.
I was using a mobile phone and I found that when I held it up to my ear, I was hitting myself in the head. And there's something wrong. And it went on for a year or so. And I saw the last 10% went off in the next 6 months. Playing chess. Now I'm a lucky man.